We need to take charge of our future. I do not want people who do not live in Northern Ontario making those decisions for us. I'd rather roll up my sleeves and sit with them, with the folks in the north, and talk it through and find solutions, rather than have them imposed on us. Our top 3 priorities is working with the communities to help find solutions to the ALC issues. Looking at the provision of mental health services in northeastern Ontario. Integration? Yeah, and identifying integration opportunities. The one-site hospital is a 439-bed acute facility, and what we need to do is ensure that that's what it remains. So to do that, you need other capacity in the community, first of all, and you also need to look at the process of how is a patient admitted and discharged. And where do they go from there? Do they have a place to go? So through these working committees, that's exactly what they're doing right now. We have to clearly articulate what is it that we need more of. You know, there was an outcry that, oh, we need more beds. We need more beds in the hospital. We need more hospital beds. I'd agree that we may need more beds. Not so sure it's hospital beds. But if we had reacted to that outcry, we would have done a disservice to this community. So it's making sure that the decisions that we make, and that's why the work of the committee is very, very critical, because whatever we decide, that's what we have to, so it's got to be short-term and long-term, because the solution that was people were pushing for was not what we needed. And to resist that is very, very challenging when you can see, no, that's not, it's over here. And I think we do have the community of the Northeast better understanding that now.
The province is just working right now on the development of a new funding methodology. It's called health-based allocation methodology, to try and more appropriately fund populations for their health. So rather than just doing it based on population increase, which we always lose in the north, looking at things like the health status of the population. As they're increasing the funding, doing it in such a way that actually meets the healthcare needs of the population.
So that it's not just spread over. So 3 years ago, they just took the money that was actually being allocated, added it all up, gave it to the LHINs. And now, as Terry said, they're actually looking at different models that would not be just population-based. It has certainly, you can see the results of the LHINs trying to influence decision-making. Too early in the game to go much further than that. There's some examples of some of the things that they've done, but there's a huge systemic problem here, and with 3 years under their belt, they had a false start. I think it's fair to say there was all kinds of nonsense that happened, which was most unfortunate. But I think we're on the right track. They've been given permission to go forward, and we need to be bold and get on with it.